The UN high-level meeting on NCDs and mental health is incredibly important for us. It's the thing we've been calling for all along. The journey for the high-level meeting has been an extraordinary one. It started for me on a beach in Barbados. It was the place where I had the first conversation with the directors of NCDs and mental health from WHO when we were there for an event on NCDs and mental health with the government of Barbados. What was so exciting was we agreed that we really could make it happen. We really could make the first UN high-level meeting on NCDs and mental health a reality.
Having mental health at the core of a high-level meeting at the United Nations is really a huge milestone for us working in the mental health sector. And having mental health there in the title, which sometimes feels like a small thing to say, but it's never been there before. And knowing that as an organization we've played a role to make that happen and influence actually that presence and the naming in the title, I think it has been very satisfying.
What that meant was mental health was going to play a central role in these discussions, that it would be the first time that mental health had that prominence and had the attention of all of the UN member states. And then it started to become apparent that this was a big deal and it was something that we really needed to work on and prioritise. So one of the things we knew that we needed to do for the high-level meeting was to have focused advocacy. We couldn't go in as a mental health community with a huge range of issues that we wanted covered and commitments that we wanted made. We knew that in this first high-level meeting for mental health, we needed to be together and focus and act as a one big advocacy team. So we set up this meeting. We invited WHO, UNICEF, the UN Foundation, Africa CDC, the Red Cross, and a couple more. And I went into that quite hopeful. I was like, they've all accepted this invite. This is great. We're gonna thrash it out. We're gonna come to an agreement of what priority issues we're gonna work on, and we're gonna make a commitment to a shared advocacy strategy. And this is gonna be great. We're more than a year out from the high-level meeting. This is brilliant. Like, this is gonna be so exciting. And then we had this meeting, this Zoom call, and it was just quiet. And I came out of the call and I just was so deflated because I thought, we're not going to get on the same page. A couple of weeks later, we went to the WHO Mental Health Forum in Geneva. I think it was the last session. There was a presentation from WHO. On their slide, it said their 3 priorities are suicide prevention, child and adolescent mental health, and deinstitutionalization. And they're exactly the priorities that we were talking about in that meeting before.
We were very excited when WHO announced its priorities for the high-level meeting on mental health. We saw real commitments from WHO to work with us on a shared agenda. That was super exciting.
For me, it took that sort of public announcement of WHO saying, these are the priority issues, we are going to push on these for the high-level meeting, for then us to feel that we had that sort of mandate, the backing, the momentum as civil society to be pushing those as well, knowing that we were aligned with WHO and others on what those priorities should be.
Priorities set by global organizations were actually quite closely aligned with those that the advocates with lived experience were wanted to champion from their kind of national work and national experience. So we knew from the start that the biggest opportunity to directly influence the high-level meeting and the political declaration, and also the governments participating in the negotiations, were to get a lot of advocates and a lot of civil society to New York.
One of the things that had most meaning for many people was the stakeholder hearings that happened in the spring of 2025. We were able to take young people from all over the world to New York and to have them speak for themselves about why mental health matters. We know that deeply affected people who were then negotiating around the outcomes of the UN high-level meeting and really helped us get a good outcome with strong language in the political declaration.
Hi, my name is Stephanie Whiteman. I am a public health advocate. I work with the Global Mental Health Action Network. I'm one of the members. As a young advocate, I know firsthand that authentic progress begins when we invest in people-powered responses. This was my first time speaking at such a global event, and it was very nerve-wracking.
Hello, my name is Lucero Andaluz.
Es vital que usemos esta oportunidad para acelerar el progreso en salud mental.
It was one of the highlights of my advocacy career.
We had the morning session of the multi-stakeholder hearing. We had taken a couple of statements, but we wanted more, and we had a fear that the whole hearing will complete and we only maybe have 2 statements. And we decided to change our strategy in terms of how we show up in the room, and that strategy worked. In the second half, one of the most probably fulfilling moments of my career, those like 2 or 3 hours in the second half of the day, we were getting statement after statement after statement of our community, making sure that mental health was really heard in the room.
This high-level meeting is an opportunity for member states to commit to invest in mental health.
Mental health is not a silo. It intersects with climate, poverty, gender, education.
Mental health is intrinsic to every health issue.
I have observed and witnessed that mental health is often not prioritized even at the policy level in several African countries.
One of the Mental Health Action Network members gave their intervention, and there was like a heartbeat of silence afterwards, and then someone started clapping, and then somebody else started clapping, and we started to get applause, and then it started to happen for every one of the mental health statements.
It is critical governments shift health systems.
I urge member states to politically declare an equitable investment in care away from harmful institutions.
Deinstitutionalizing mental health care.
Surviving a stroke at the age of 28 deepened my understanding and appreciation of the urgency of this complex global health crisis.
It was honestly one of the best moments I've ever had at work. Civil society from around the world, from local communities, were in New York, at the seat of power, being truly heard.
We organised a high-level side event with Welcome. We really wanted to get senior leadership from politics, from the UN, from civil society, from business, all together to demonstrate why mental health matters.
We're here today for No Health Without Mental Health, a shared commitment.
No health without mental health.
I urge all countries to make mental health a priority now.
This is why the commitments made during this high-level meeting are so critical.
The inclusion of mental health in the high-level meeting is a landmark achievement.
This is a major opportunity for us to prioritize mental health.
It's just fantastic to see so many people here tonight. Mental health is on the agenda.
So we're a platform for young people, so we're definitely listening to young people.
There is no health without mental health. That could not be more important.
And so many things have changed thanks to this community.
We wanted to put mental health on the map. We wanted a conversation at UN level about mental health. This is the first time we are now seeing it in a high-level meeting. Thank you so much.
We had a number of different governments prepared to talk about what they're doing on mental health, why they're doing it, and why more action is necessary. That is key to the UN high-level meeting itself.
Antigua and Barbuda is particularly pleased to be engaged in this discussion.
Japan is committed to contribute.
The critical part across the journey is how we have been able to position experts by experience on the main stages as equals and really celebrate the expertise that they bring.
We need you to hear us. We are speaking, we need you to hear us. Please listen to us.
And when we talk about human rights, we need to think about dignity.
For me, this question really resonates with me in a very personal level.
I do believe that we are a world in crisis.
It has been so meaningful to hear so many people speak so bravely about their own mental health journey. I think the UN high-level meeting was a huge success. We were really surprised about how many member states wanted to talk about mental health. We ourselves were asked to speak. That was so important because we want civil society to be heard. We want people with lived experience to be heard.
We hear you and your mental health matters. Because as Sasha and Lucero have said, they come from Lebanon and Peru respectively. This meeting and its high-level political declaration is not just words, it's lives.
What we're most excited about is that this high-level meeting has a declaration that we can call on to encourage governments to take that next step, to actually deliver better services for all on mental health.
The next part and the next outcomes is how we use that. Are we referring back to that? Are we building layer upon layer on the same commitments until it becomes a non-negotiable that governments need to do this, that those with power and wealth and the ability to support people's lives have to do what is written in that political declaration.